Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Today's Coffee with Carrie, we're going to talk about telehealth versus telemedicine. We get this question all the time, and the words are a lot of time used interchangeably, but they're really quite different. So historically, telemedicine is what you've heard about for years. It a lot of times is referred to, and you'll hear people say that they have telemedicine when it's actually just phone, no video, talking to a doctor, or it's asynchronous where you're sending images, maybe text messages to a physician, and there's back and forth. Some people even refer to it as online portal, kind of chatting back and forth with messaging with a physician. And your hospitals, when they refer to telemedicine, it's typically facility, site to site. You might have a rural hospital that has a camera or a medical cart in a particular room, and they connect to maybe neurology at a sister site, a larger location. That was used a lot in rural and community health, where you didn't have these specialty docs that wanted to live in small town USA and accessibility was an issue. That's when telemedicine was typically used, and kind of the nomenclature of that. When you talk about telehealth, this is really putting the patient to connect anywhere. And that means the patient can be at home, they can be in their office, they can be in a car, hopefully not driving. But telehealth is really the future. It's where things are headed. It's where, as a healthcare organization, you need to be thinking that to acquire and retain your patients, to service them after hours and have that billable revenue, the weekends, and really expanding your business beyond physical four walls, whether you're a hospital, whether you're a community bank, whether you're a specialty doc, using it for, follow-up, proactive care, pre and post. It has to be telehealth that home can be an originating site, that the patient, it's very simple for them to use. One of the things that we talk a lot about is not only the patient experience, which is key to telehealth adoption, but the physician experiences, which is key to telehealth adoption. And what I mean by that is a lot of times you'll see telemedicine platforms that you're sending your own patients to go download a third-party application, and the physicians are in a situation where they're spending more time being tech support than they are practicing medicine. They get to their telehealth or telemedicine appointment. It should be called telehealth. They get to their telehealth appointment and they're talking to the patient, and the patient, wasn't there a couple minutes early. They now figure out they have to download an app. They're asking the doctor what code they have to enter or what link they have to go to. And it really puts the physician behind schedule, because a lot of times physicians are doing telehealth appointments as well as physical appointments in the office. And so as you look at telehealth versus telemedicine, there's key criteria that you need to consider. Number one, can you scale this beyond physical locations into the home? That's where things are going. If you're servicing Medicare population, as you're looking at baby boomers aging at home, if you're looking at renal care, things like that, that you need to be in home, hospice, home health, things like that, post-surgical consults, you need a solution. Your patient can connect from anywhere, meaning home. The second one is the patient experience. You have to have a good patient experience in which the patient, it's so simplistic, two-click simplicity, where they can connect. They don't need tech support. They don't need training. They don't need instructions. That's going to be critical for scaling, is that is available and that you can do that. The last one is really the physician experience. Can your physicians connect anywhere through the browser without having to download apps? Can they connect from their home computer? Obviously HIPAA compliant through security. as long as they have a browser and webcam. Can they connect from their phone? Can they connect from clinical rotations? Maybe you're at their hospital, they're at a renal facility, they're at a long-term care facility. The last thing is your healthcare organization trying to expand and service business-to-business clients, i.e., are you trying to service home health or hospice agency? Are you servicing nursing facilities, renal facilities, hospitals, urgent care clinics, things like that? If you're implementing telemedicine, you're going to be buying expensive hardware, software, medical carts at 90% more cost than a true browser-based telehealth solution. So if that's in your cards and you're trying to scale it, whether it's now or in the future, don't get into a situation where you're contemplating telehealth versus telemedicine and you're in a situation where you don't have the CapEx to support hardware and software scaling with telemedicine, and it comes in a closet, a throwaway, which we see all the time with clients, and that you can't support the future growth and the future of telehealth. So that's your today's Coffee with Carrie on the difference of telehealth versus telemedicine. Feel free to click below, download our latest white paper, and listen to podcasts that we talk about all the use cases for telehealth.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.